Does contraception impact long-term fertility? Have you ever wondered if using contraception could affect your ability to conceive later on? This is a common concern, but research shows that long-term use of most contraceptive methods does not negatively impact a woman's long-term fertility. In fact, fertility generally returns to normal after stopping contraception, with no lasting reduction in the ability to conceive. Let's break it down by method. For oral contraceptives, also known as birth control pills, studies indicate that women who use them for several years do not experience long-term harm to their fertility. After stopping the pill, there may be a short delay of a few menstrual cycles, typically around 3 months, before fertility returns to normal. After this period, the chance of pregnancy is similar to that of women who used other methods or none at all. Interestingly, some evidence even suggests that longer-term use might be associated with improved chances of pregnancy, although more research is needed in this area. The hormones in the pill clear quickly from the body, allowing normal cycles and fertility to resume within months after discontinuation. Now, let's talk about injectable contraceptives, such as Depo-Provera. These can cause a longer delay in the return of fertility, sometimes taking 6 to 12 months or even up to 18 months for normal menstrual cycles to resume. This delay is due to the longer-lasting hormonal effects of the injection. However, it is important to note that this delay is temporary and long-term fertility is not impaired. When it comes to intrauterine devices, implants, patches, and rings, fertility generally returns quickly after stopping these methods, often within 2 to 4 menstrual cycles. There is no evidence that long-term use of these contraceptives reduces the likelihood of conception in the long run. Another important point is that the duration of contraceptive use does not significantly affect a woman's ability to conceive after stopping. Factors like age and baseline fertility status play a more crucial role in influencing fertility than contraceptive history. Some studies have noted slight variations in how quickly fertility returns depending on specific hormonal formulations or the age at first use, but these differences are minor and not well established. Overall, the consensus is clear. Contraception does not cause permanent infertility. From a sexual health perspective, understanding that contraception does not lead to lasting infertility can help ease anxiety about family planning. It encourages appropriate contraceptive use to prevent sexually transmitted infections and unintended pregnancies. Women planning to conceive after using contraception should allow some time for their menstrual cycles to normalize, especially after using injectable methods. Consulting healthcare providers for personalized advice is always a good idea. In summary, contraception is safe for long-term fertility. While there may be temporary delays in fertility return after stopping certain methods, there is no evidence of lasting negative effects on the ability to conceive.